Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello, you're welcome to this week's episode of Health Watch and Advent Cable Network Nigeria. I am Angela Mwenze. On the previous episode, we started the discussion on maternal mortality. And just for recap, maternal mortality rate is unacceptably high in Nigeria. According to the World Health Organization, 34% of global maternal deaths happen in Nigeria and India alone, which is about 812 deaths per 100,000 live births. This means that out of every 100,000 births, about 812 women will die. Of all the causes of maternal deaths, the 5 highest causes of maternal deaths are severe bleeding, infection, hypertensive disorder in pregnancy, obstructed labor, and complication following unsafe abortion. There are also the issue of education, religion, and culture. We have discussed in the previous episode severe bleeding, hypertensive disorder in pregnancy, and we touched a little on complication following unsafe abortion and how they're responsible for maternal deaths. So today, we shall continue discussion on other causes. Remember, all these complications are highly avoidable and preventable. My guest is still Dr. Nathaniel Adewole. He's a consultant obstetrician and gynecologist at the University of Abuja Teaching Hospital. You're welcome back to the program.
Thank you so much.
You know, I told you I was going to bring you back because we didn't finish our discussion on these causes of maternal mortality. And we, from our discussion, we had done severe bleeding. We had done hypertensive disorder. And if I remember clearly from the last discussion we had, it is very important. All these things we're going to be talking about can be nipped in the bud early if we go for antenatal care.
Okay.
And
make sure we have an hospital
yes,
delivery under a skilled medical
person. So these are the vital things that we took away. Government established or registered or licensed hospitals.
Yes, can be government or private.
Private, but licensed hospital, and under the supervision of a skilled personnel or medical personnel. So that's the point we want to just take back from that previous discussion. So today, we're going to continue discussion on causes, and from these causes, we bring out how it can be prevented and what the woman should look out for early enough to save her. So now, I want to start with obstructed labor.
Well,
obstructed labor just sounds like labor that's been obstructed.
That's simple English.
Yeah, simple English.
And exactly, you are correct.
Okay.
Obstructed labor is, when a labor, a woman that is in labor, the labor could not go further until there is definitive intervention, provided that they've ensured there is adequate contractions and other things. If that woman could not deliver without further intervention, which in most cases is usually surgical. That's what we call obstructed labor.
Okay,
so when there is obstructed labor, that baby could not pass through the birth canal without further assistance. Naturally, once there is when there is contraction, the contraction helps the baby to come out naturally. But when, in presence of that adequate contraction, the baby could not descend further, the baby could not be delivered, you say the baby is obstructed.
Okay. So
it's like the passage, and it could be caused by 2 things. It's either one, the baby is too big for the passage.
Okay.
If the baby's head, for example, is too big, the baby itself, the fetus, is too big. If the fetus is too big to pass through a passage, for example, if you have a hole that is like this, and you are trying to force
something bigger
to pass through it, this is the fetus, this is the outlet.
Yes.
If it could not pass through, ideally it should be something adequate that can pass through. You can see it pass, but if it's like this, there's no way it can pass through. The other one cause is if the outlet, the pelvis of the woman is too small, even when the baby is small, that means that's why when a woman has contracted pelvis, even with normal size baby, that baby may not be able to pass.
Okay.
Do you get it?
I get it. But two questions are coming to my mind.
Yes.
Or should I wait for you to get there, or should I bring it now?
Okay, go ahead.
What would make a baby so big that they can't pass through the birth? Is it just a baby just naturally big?
There are some that are okay constitutionally, just like what makes you will see some people that are naturally big, or genetically they are big.
Okay, so it's not the fault of the mother that she ate
No.
too much.
No, you can see some people natural, even if without eating much, you can see their size. They are big. Then there are also some other conditions that can make people to be big, the fetus to be big in a womb, like a woman with diabetes.
Oh, okay.
Diabetic patients have the child that they are likely to have a big baby, what we call macrosomic baby.
Oh, really? Okay.
But it's not naturally, most times, not because of what the woman ate or not. Whether a woman eats or not, the baby will take whatever he or she needs.
All right, okay.
We should get that concept clear.
Okay.
So obstructed labor will occur when there could be even when there is adequate contraction, that baby could not pass to be delivered.
Okay.
And when this occurs, a lot of times, the most common intervention is actually cesarean section.
Okay.
There are other interventions that are not so common nowadays that one can do, but the most common intervention for obstructed labor is cesarean section.
Okay.
And the cesarean section is so safe nowadays. The major thing is that right from antenatal, with adequate monitoring, one will be able to predict, and then rather from the size, physical examination of this baby is likely to be big. And right now we have ultrasound, which can accurately, to a very small margin of error, measure the baby weight of the baby. For example, a woman that is delivering for the first time, your estimated fetal weight maybe at 10, let's say 38 weeks, it was 4.5 kilograms. Okay. Why do you want that woman to deliver on her? Okay. Because that baby may not likely pass through for a first timer. Okay. Then another thing that you saw a woman that, this antenatal that we just assume, we mentioned the fact that antenatal is critical. A woman that is short stature, especially less than 1.52 meters, it's already a warning sign that the pelvis may not be able to. Not necessarily that all short women will not be able to deliver, but that one should be, any woman that is less than 1.52 should be examined. There is what we call pelvic examination to see whether the pelvis will be adequate. There are parameters to be able to allow a normal sized baby to pass through. So if you see that the baby is so contracted, even if the baby is small, you don't want to take that chance. So that way we can those are prevention through the antenatal. And when in labor, you have seen that this woman is in labor, has been in labor for some time, is having adequate contraction. The baby, the cervix is dilating, but the head is not descending. It's a warning sign. Okay.
So some can be dictated before the time of delivery.
Yes.
Some will be seen at the point of delivery.
At the points of delivery.
Okay.
During labor.
During labor, okay.
During labor, it could be. Yes. And some, funny enough, it could be normal size. And even a woman that has delivered normal size baby, still presenting with the head. If the head is abnormally, presented, abnormal presentation, because there's a particular way the head will present that will provide a good diameter for delivery of that baby. If that baby the head is not well positioned, though normal size, could be a problem.
Okay.
Could be a problem. For example, if a baby, what we expect a baby to be flexed, if the head is deflexed up, the diameter that we have to go through to pass will be bigger.
All right.
So sometimes also abnormal presentation, abnormal line of the abnormal presentation of the head can lead to obstructed labor.
Okay.
Another cause of obstructed labor is also when there is abnormal line. When the baby is supposed to lie with the head
facing the cervix
down, or sometimes with the buttock, that's breech presentation. If that baby is lying across, there is no way that baby.
So you're hanging by the side. You're
no,
sitting.
yes, it's just like somebody wants to enter the door and now lying flat.
Lie flat. Okay. No way. There is
no way.
Yes.
If that woman goes into labor, it's going to have obstructed labor.
So I want to ask a question.
And if they try to force, it can. There is no way that woman can deliver. Okay. And that is why, if those people that are not in the hospital, some will even be pumping more. And one of the things we discover is that the danger of obstruction, because some of them, they will be fully dilated. Then they will not get FT men to go and sit to press the tummy
to bring out the child.
Because they've seen that, this baby, the cervix is fully dilated. I can see the head. They will be beating the woman, you are lazy. They will not get people that are strong, fresh, what we call frontal pressure.
So all that is not necessary.
No, it's not only necessary, it's very dangerous.
Yeah.
Because that can make the uterus, what we call rupture uterus, the womb to burst.
What?
Yes. That's one of the common, that's the danger of going to the traditional birth attendants. Because sometimes even what they are seeing as the head is still far off. But because of the long process, caput has formed. That means the shaping of the head with collection of some water. That's what is seen outside. But the real head is still up. Okay. So they will not say, I can see the head down now. Madam, you are lazy.
Oh, dear.
So that's why delivery under skilled birth attendant is critical in preventing maternal mortality. Because obstructed labor is another major contributor to maternal mortality.
And if the woman keeps pushing, she will eventually be exhausted. And
a lot of times, you can have baby that are already compromised with low ABGAS score. Quite a number of times, there will be mortality for the baby. That means the baby will die. And with the complication like rupture uterus for the
and when
mother.
It's complicated, you now quickly take to the hospital and then nothing can be done.
And so many other consequences, waste of resources, the life of the woman at risk. Even sometimes the future fertility is compromised.
Now, there's a question I want to ask. It came to my mind now. I heard it when I was younger, but I realized that it's still there because somehow I thought it had gone, but it's still hanging somewhere. Because they tell women, sleep with as many men as you can sleep with, so that your cervix can open well, so that when you want to deliver, it's easy for your child to come out. Now, I don't know if you've heard it as a medical doctor, but as a young girl, I know it was prevalent. People were saying, if you don't do it, so how will you be able to deliver?
They normally encourage them to sleep with their husband.
Yeah, even then they said before you even marry.
No, that's a fallacy.
That's a fallacy. Even when you're married, it's
even risky because they can contract infections, complications.
Yeah. Okay, now that was for young girls.
But that's not related. But even for married people, they advise them to meet. We encourage sexual contact between spouses during the pregnancy, but not necessarily because it has effects on the delivery, but because it also helps in psychological well-being of the woman.
Oh, it's psychological well-being of the woman,
yes.
Not because it is expanding the cervix to make it big enough for the child to come out. Because I can imagine if I remember the structure of the human, I don't think that you can even get to the cervix.
Yes, it's for the psychological. When a woman feels loved, it also helps the woman to bear the psychology, to have its right psychological preparedness for labor.
Okay.
A woman that is irritated, annoyed, feel rejected during pregnancy, during labor, it will have effect on it. So it's good for the psychology of the woman.
Okay.
For the spouses to meet, but not because it has. What of those people that their husband travel abroad?
And they're not with them. Don't
Well,
they
no,
still
there's,
deliver?
don't they deliver normally?
Very good point.
So-
So for those people that are trying to deceive people, to tell them that this is the
but
reason.
definitely we encourage normal copulation
Yeah.
during pregnancy.
During pregnancy.
It's good. In fact, men that abandon their wife because of pregnancy, they feel rejected. It's a lot of psychological trauma
on the woman.
on the woman,
Yeah.
and can be transferred equally to postpartum depression. But that's
a
another thing. Don't let us go into that.
We want to go in a quick
Don't
break.
let-
When we
don't-
return,
all right.
we will now conclude on this and then speak on other causes of mortality and birth. We'll be right back, viewers.
Crossfire is a program that treats controversial topics on diverse issues surrounding the family, church, and society.
Does it mean if a woman now prays with her hair uncovered, God will not honor the prayer?
Should single ladies ask single guys out on a date?
It's not a sign of desperation. It's you knowing what you want and going for it.
Okay.
But you can't tell me that comedy in the church is wrong.
Written by our-
if
our-
you
our
go through
contemporary-
our Church of Nigeria hymn now, you will see so many hymns written by Nigerians.
You know, a man is seeing something here, he's going for something else. Men are confused,
That's why I said
generally.
you have to help them out.
You're saying something,
Okay,
sir.
a minute.
Sir, can you stop a bird from flying? Depending.
But we are not instituting, we are forgiving.
No, you have forgiven,
Yes.
but that forgiveness amounts to a criminal offense.
How?
Hold
now?
on. Section 7.
My brother,
Anybody can bring
if
this.
the foundation be destroyed, what can the righteous do? It matters, so.
No, I'm not saying nobody is destroying any foundation here.
Welcome back, viewers. Before we went on the break, we were still discussing maternal mortality, and this is not maternal mortality 2. And my guest is Dr. Nathaniel Adewole. Thank you very much, sir. Thank you for clearing that those misconceptions there. It's very healthy. So the reason for copulation during pregnancy is not because you're widening the cervix. It's just
not.
for the psychology of the woman. So we've done obstructive labor. Obstructed labor, you know. So whatever the case in obstructed labor, when you go for antenatal, if you're in a hospital,
They'll be able
to tell you
either during antenatal or during labor. So that it can be picked up early and intervention done early in order to avoid complications.
Okay, let's go to infections.
Infection is mainly, of course, for the world, when there is postpartum infection, after the delivery, the infection could be so severe that could compromise the life of the woman. It can even become from just genital infection, it becomes septicemia, affecting the whole body, the woman going into shock.
That's after delivery?
After delivery. Oh. For example, one of the commonest causes is this obstructed labor. The woman has stayed in labor for about 2-3 days. Several VE has been done. Some even when by the time you are doing the intervention like cesarean section, you'll be shocked. Everywhere is smelling. So the major thing is to avoid infection is, number one, a woman should not be in labor over between 12 and at most 24 hours. That woman should have been delivered.
Okay.
Depending on which stage of labor the woman comes in, 12 to 24 hours, that woman should have been delivered. And 2, delivering in unhygienic environment is a risk for infection.
Okay.
The issue of rupture of membrane, you know, water burst, and people say, I'm waiting at home until labor starts. No, immediately the water burst, that rupture of membrane, that woman should report in the hospital. Because if the water bursts and the woman stays more than 24 hours, there's a high risk of infection, postpartum infection.
Okay.
It's a great risk factor. And the next thing is, the only other thing I want to say in order not to waste your time is that the way the general Nigerian, what is making it a complicated issue is issue of fake antibiotics, fake drugs.
Okay.
Because even when you now use drugs, you would think that you are giving the appropriate drugs, But people are taking it and they're not getting good reports. And this is what we have to really search our heart as a country. Our craze for money, our idolizing money has made people to go to any extent that the extent of putting the life of people at risk by importing fake drugs, substandard drugs. So that when the drugs are given at the early, they're supposed to combat the infection, it will not. The next thing is that before you know it has advanced. So I want to make an appeal. Regulatory agency should ensure that we have potent drugs.
Okay. So the reason the antibiotic is when trying to treat the infection.
Prevent infection first.
Okay.
For example, if the woman comes in with prolonged rupture of membrane and you give antibiotics, but you are not aware that that antibiotics is not working before you know it. So the first reason for good antibiotics is to even prevent the infection again. Okay. For example, woman with obstructive labor, you've already observed that this woman already has even started the process of infection. You give appropriate antibiotics, you should be able to combat it.
Okay.
But if that antibiotic is substandard, instead of combating it, it will be escalating. Yeah. And the longer the station you want. And once it becomes a septicemic stage, it's difficult to get to septicemic shock. It affects all the organs of the body. Wow. Urine production, kidney failure, and other areas.
Wow.
It can lead to DIC, leading to bleeding again.
Wow.
So we must get that in order to reduce this issue of infection. One is for women to avoid laboring in prayer houses and at home TBA for long. They should not labor there at all. And also other people, when they are managing, they should ensure that they will deliver the woman early. Women that had rupture of membrane should report in the hospital early. They should not wait at home.
Okay.
They should not wait at home. I think those are the issues about it.
So the main thing is when you are in labor, you've had your ruptured membrane. It's exclusive. It is extremely important to head to the hospital.
Whether the contraction has started or not.
Just head to the hospital.
Get to the hospital.
Because this could open you up to infection.
Yes, because the thing that's what is separating the outside world from the fetus. Once that barrier is removed, infection, the other organism can come in and start silent infection. And before there will be, by the time there is sign, it's already advanced infection. There are signs, then it's already advanced infection.
I think I like the part that you talked about with going to prayer house, because it's becoming a major issue. People will rather stay in prayer house and keep praying, taking anointing oil, hoping that the anointing oil will make the child pull out easily, because it is oil, with that mindset. But it's very important. Apart from that, when during pregnancy, as in the process of pregnancy, when you are just pregnant, are there other infection a woman can pick up at that particular time?
Well, there are infections that won't
general, like sexually transmitted. I don't know if they still have any effect on people.
Something like there will be signs, something like urinary tract infection. You discover that you are urinating frequently, there is pain when you are passing urine. Those infections should be treated early, because so that they will not ask for a reservoir of infection. So any sign of infection should be treated early in pregnancy. Then this issue about the prayer house, in fact, that's one of the major contributors to maternal mortality now. I wonder sometimes whether education helps us in this country.
Yeah.
You see an educated person, a graduate, well-to-do, we go to a traditional birth center, we go to prayer houses and say, I want to deliver like an Hebrew woman. And we forgot that even people that brought the Christianity, when the Christianity being brought to Nigerians, missionaries were trained in medical line. So why will we be going to people that are not skilled in delivery? They will not know their limits. For example, those that wait because they said, the baby, so I can see the baby. Push. They'll be waiting. They can even be putting local concussion into the private, that is one witch or one in-law that is not making the baby to come out. Some will even give unnecessary cuts. So this issue of prayer house is becoming a thing of shame to the body of Christ. where there is no proper skill, proper setup, skill-based attendant, they should not go there. You can pray for a woman where the woman is in the hospital. You can be praying. Prayer is not a barrier. The woman does not have to be there. She does not have to be there. So we should get this thing. It's one of the major contributors to maternal mortality before they come to hospital. Some of them, they will tell them that they need cesarean section. Maybe later we'll talk about that. The next is that I don't want to, I know God will allow me to do that. There will be someone person in one prayer house said they will be praying for them. Before you know it, they will have ruptured uterus. And by the time they have ruptured uterus, before some of them could even be taken to the hospital,
there's already a problem. Yeah, I had a guest one time on the program, and he said something profound. He said, medical science is not fighting with pastors. We're not fighting with our spiritual heads. There's no war. You do the prayer. We will handle the treatment.
That's correct.
We work hand in hand. We're not fighting. Nobody's competing. You pray. We will do the one we're supposed to do.
Yes.
And we'll do it. But we just want you to also pray for us as we go ahead with what we're doing. Period.
And it's God that gave the intellect.
That gave the intellect. It's also from the devil. The devil can never do anything good for anybody. So, well, that's for infection on so if you have your rupture, maybe your water broke, as is the normal language, quickly head to the hospital. Infection can be very dangerous.
Don't stay in a tomb or anywhere you are in labor for long. Prolonged labor can lead to infection.
Prolonged labor leads to infection.
Because the longer it stays, once a woman sees show, what remove the barrier, that the show is the one that cover that thing that comes as show, is one that is separating the fetus, the internal from the external. When that is come out, any infection has direct access. So that's why a woman after the woman should not stay in long in labor. Once it's more than 24 hours, the risk of infection is very high.
Okay, so let's move over to complication from unsafe abortion.
Okay.
Because that's one of the ones that...
You know, in the Christendom, we are too judgmental. The issue of love is no longer there. The only thing I want to say is that it's definitely, no matter what is preached, the church is meant actually, Christ come for the sinner, not for the righteous. If they are perfect, they have not been named for Christ. So when there is, what baffles me is the way we abandon people that are already had done the abortion. They may not have the resources. One, there is this stigma around them. Nobody wants to associate with them. They may not have the resources to go to the appropriate place even for treatment. So I will advise the church should show more love. The point that thing occurs is not the point to be judgmental, but the time to show love, carry the person to hospital. And also for married people do abortions. And this is where family planning comes in. I'm happy that we have talked about family planning on this platform and before. I've seen where couples had about 4 kids in 5 years and they are pregnant again. The husband was the one who was supposed to be an and she was the one that took the woman to a quack and she had complications. So this issue of family planning is also critical to prevent the death from unsafe abortion, death from unsafe abortion, complication of unsafe abortion. It is important that married couple should adopt family planning as appropriate. But apart from family planning, the other thing I want to emphasize is that the church should not be judgmental at the time when people have problems. But they should show love, make sure we save that person first. Because abandoning them, one, nobody to take care of them. They may not have the fund to even go for where they can be treated. That's the issue that I want us to talk about especially. And then for also those that are single, they need to also be careful. the injection in order to avoid unwanted pregnancies.
Now, abortion in itself, because I think it was the previous episode when we touched a little bit of it. You also talked about that miscarriage is also an abortion.
Miscarriage is an abortion.
Is an abortion. You know, sometimes when we look at the word abortion, all we look at is a lady has gotten pregnant and she's a sinner. She's a sinner and all that. But really, somebody could have been raped and then got pregnant and may not want the child. You know, so I want to understand first of all, I want to look at the complications that come from abortion first. Then I also want to look at the concept of abortion on its own. You know.
Let me say this. I will advise, if anybody is raped, please, they should seek medical help immediately.
Okay.
Because one of the steps that will be taken immediately, one, is the issue to prevent screen for infection and take steps to prevent infection. Secondly, a step will be taken to prevent unwanted pregnancy.
Okay. So don't keep quiet.
Don't keep quiet.
Because there's the idea of don't talk.
They must take that, even if you are going to keep quiet, you want to make it, please take that person to a medical personnel and hospital for necessary steps to be taken.
Okay. So which means the pregnancy can be avoided.
Can be avoided.
From rape, yeah, okay.
Yes.
Even for people that are not have had some form of sexual intercourse, pregnancy can be avoided.
Yes.
If they go get to
yes.
the hospital.
That's a form of primary planning, immediate.
Yes. Okay.
Post-coital contraceptive methods can be applied to those people that are raped or abused.
Okay, we're still going to come back on this topic on this. We're going to go on another break, and then when we return, we'll now conclude this issue on this abortion, maternal mortality, complications from abortion. All right, viewers, we'll be right back.
Now streaming, now analyzing, now assessing, now discussing, now sharing your thoughts on everything and every issue that affects you. ACNN is now streaming. Discusses the issues trending and the matters that matter to us all. Join us every Monday to Friday at 10 a.m. on ACNN as we go in-depth into every issue that impacts our lives, our communities, and our country.
Welcome back, viewers. Before we went on the break, we're still discussing maternal mortality, and my guest is still Dr. Nathaniel Adewole. Thank you very much, sir.
Thank you. It's nice being here once again.
Yeah. So on the issue of abortion, you know, we're just talking about wanted to. Okay, go ahead.
You know, when it comes to abortion, we are against abortion.
Mm-hmm.
But the problem is that somebody had abortion. They knew that woman was blamed because of abortion. When the people supposedly to be Christian knew, because of that, they will be judgmental.
Mm-hmm.
They will even stigmatize and abandon the person to his or her, to her fate.
Yeah.
Some may not have even the family that are elders in the church, their own relation. Okay, you've got to do abortion, you are on your own. Now, that old person will not have the resources.
Okay.
That person may end up going to quacks, which eventually can lead to death.
To the complications that come from
yes,
abortion.
what you are saying is that once somebody has had you discover, we should not be too judgmental when the person has already had abortion. But the church must show love and ensure the person is alive first before you. It's only a live person you can preach to.
You can preach to. Okay. So
that's a major.
So in summary, we are not encouraging abortion.
We are not.
We are not encouraging abortion here. Yes. Okay.
We are not.
Okay. Excellent. So, but if
if it has occurred, I've seen whereby they will leave the person to our faith. Even the relation that are elders in the church, this your own child has made a mistake. He has made a mistake already. You have to save that. Then you cannot preach to her.
Okay.
That's what I'm wanted to.
Okay, to clear
emphasize.
That. Okay, that's wonderful. Okay, so we have other things that are responsible for complications. You know, we've discussed the 5 that are top on the list. You know, as discussed, but we also have malaria, I think, which is another big one there.
No, so let me just malaria and anemia are some of the indirect causes of maternal mortality.
Okay.
We know that malaria is endemic in our society. And if malaria is not treated early, can lead to maternal death.
Okay.
Especially people that are getting pregnant for the first time, their immune is more suppressed, so they can be exposed to bouts of malaria infection, repeated malaria infection, which can be very severe sometimes. It has to be treated early. The problem comes in because people think that, look, if I take malaria drug, it will affect my baby. This is not true. It's actually not treating the malaria
that actually affects the baby.
The baby, and eventually can lead to maternal mortality in the mother. So any sign of malaria should be addressed early for the safety of the baby and the safety of the mother.
Okay.
That's the take home about that. Another thing is issue of anemia. This one is more extensive because of the low socioeconomic class, because of the poverty in the land, and also because of frequent childbirth. Women will not recover from the last delivery. They will get pregnant again.
For the next one.
So they are entering the pregnancy in a state that is not optimal. They may have low blood level, what we call anemia.
Okay.
Their PCV will be low. And remember, pregnancy will demand more.
Yeah, of course.
Nutrients. The finances is not there to take adequate diet, has not recovered from the other one.
The previous one.
So, anemia is one of the leading causes, indirect causes of maternal death.
Okay. So anemia mainly from a previous birth that was not, you didn't allow full recovery. Yeah.
And also from poverty.
Poverty, not eating well. And
not having adequately or balanced diet.
Okay.
You know, anemia can lead to heart failure. Anemia can lead to a lot of other complications. You just notice, and once the heart failure is turning, that we see that the leg starts swelling, difficulty in breathing, difficulty in walking, more expensive on the already low socioeconomic class before. So it's a form of chain reaction.
Okay.
And if care is not taken, the end of it is maternal mortality. So to prevent this is number one, there should be adequate planning of pregnancy. Frequent deliveries does not give room for recovery, and that's where family planning also comes in.
Okay.
And two, people should try as much as possible to live within their means. Somebody is having up to about 8 children in less than 10 years, and what is their income? And a lot of our men will say, no, if you do family planning, she can be promiscuous. And then you are expecting this woman to be pregnant almost every time, and you won't allow her to do, and you will not use any form of planning. So in order to prevent this, in churches, we should do more education on it. And the cancel the men.
Yes, thank you. That's the point I'm trying to make. The education shouldn't be only for the women.
No, the men are
critical. It should be for the couple, because most of the time they just focus on the women. In fact, forget that the men are also part of it.
In fact, for this one, men will be more critical.
More critical in this, yes.
Because they are the decision makers, especially in our society. So, in order to reduce the incidence of maternal mortality that coming directly from due to anemia, it has to be done. We have to also reinforce education is critical. Health education, information, family planning. We remember family is not that we should not say we should go and multiply. But it's only the person that is alive that can multiply.
Yes.
You deliver today, this in the next 4 months or 6 months, you are pregnant again.
So I know you've told us this thing. Between pregnancies, on average,
2 years.
2 years between pregnancies. Okay.
And that's actually what our mothers
did you know, without even having the knowledge we have now.
Do you know what helped them, which is what you are missing? Maybe we should bring it in. Exclusive breastfeeding.
Okay.
We help. It's part of family planning.
Okay.
And also breastfeeding for close to 2 years can reduce the chance. But we have mentioned during the discussion on family planning, breastfeeding alone is not a family planning method that is adequate.
That is adequate, yes.
So people must do it. They must ensure that our women recover from the previous pregnancy before they take in again. And then during pregnancy, there should be, and that is where women empowerment also come in to help in reducing maternal mortality. Because a woman is empowered, she'll be able to take adequate care of herself, the food, to reduce issue of maternal mortality, issue of anemia. Remember, nutritional
very, very important.
Anemia is one of the commonest.
Okay, nutritional anemia is because you're not eating well.
Anemia due to inadequate nutrition.
So, just to touch it briefly, what kind of food should a woman be eating?
The basic content that we know: balanced diet, fruits, vegetables,
okay,
and vegetables and other things. That's all.
Okay.
Then fish, liver. That one will help the woman to recover from the previous.
So it doesn't mean that now the woman should eat like 10 bowls of food, but she should also be. You should also be mindful of balanced diet in what you're eating.
Yes, that's critical.
Okay, I want to bring up the issue of exercise during pregnancy.
Okay.
How important is it during pregnancy? I know there's some women that they actually advise them for the first few months not to.
Yes, those women that are at risk, maybe they have had recurrent miscarriage, they need bed rest. Now, if you look even for antenatal, for every antenatal visit, one of the key things that is being done during any antenatal visit is exercise.
Yeah.
The one they will do during that visit and the one they will have to continue to do, they will teach them what they can continue to do at home.
So how important? Because
it's important.
Some women do it in front of the nurse or midwife, and when they come back home, they continue moving around.
Exercise
not
is
doing the exercise.
Appropriate exercise key to healthy living.
Okay.
For example, one of the things that we didn't mention that on common cause is something like pulmonary embolism. And when there is cardiovascular problems, exercise helps to lighten the body, it helps the circulatory system, and other things. So exercise is important in also reducing maternal mortality.
Okay.
A healthy lifestyle, that's part of healthy lifestyle. A woman that lives a sedentary lifestyle, it has a risk of more complications of pregnancy.
Yeah.
So we should get that one clear too.
Okay. Now another one that comes to my mind is when a woman, when she sometimes you don't even know. Okay, I think you don't know that your child is no longer alive in the womb, or do women do you have a way of knowing? I know that's another issue that comes up during through the period of pregnancy.
Thank you for bringing this one up. This one is critical because if a baby died in the womb for a very long time, there is risk of what you call disseminated intravascular coagulation, which is a form of bleeding too.
Okay.
That can lead you to death. So it is necessary for women to take note and be able to pick it up. Two things that are key to avoid, number one, to prevent intrauterine fetal death, and to also to detect it early for proper management. One is antenatal.
Okay.
Because during antenatal, they will check the woman, they will listen to the fetal. But even at home, in general, a woman should be able to know how the baby kick.
Okay.
If a baby is no longer kicking,
or no longer moving.
No, movement is different from kicking.
Different from kicking.
And maybe I should use it. When the baby is kicking, it should be kicked regularly. A woman that will know when the kicking is reduced. So that one will help to know something is wrong. You can go to hospital, and a lot of time by a woman complain, oh, my baby is not kicking like before. Then they can check, there is problem with the artery is not, let's quickly deliver.
Okay.
So women should know, women that are pregnant women should take note how frequent, or they should be able to dictate when they be kicking up babies, not as adequate as before.
As before. Okay. So now I want to, because I'm wrapping up now, and I want to address an issue of cultural belief. There's none springing off my head now, but honestly, there's so much belief that, when you go to your mother, maybe during pregnancy, because she gave birth in maybe 2000 and maybe she gave birth in 1960 or 1970, and it has presumably worked in 1970. She feels in 2021, there's still some mothers that will tell her, this thing that's happening to you, it's not hospital, it's not everything hospital. Sometimes doctors will not see it, It's happened. In fact, it's happened around me sometimes, and I'm wondering, let the doctor find it. Say, no, doctors they don't see this one. I wish we were discussing about children. I would have, brought up issues on even the one of the skull. They said it's not formed properly. Then they dump something. They make the ladies do a lot of things because they're pregnant, or even there's one of setting the womb. There's just so many things they do.
When it comes to maternal mortality, this cultural belief is also critical. One of it is that those old people may insist we have a baby. The woman that can take delivery, you can't be going to hospital. They will just be wasting your time and your
money. Yeah, it's your money.
But they've forgotten that those baby, how many women died during delivery in those days? So this cultural belief, we have to really get over it. Another cultural belief that leads to maternal mortality, where they say, even Americans say, my mother delivered 8 children on her own. They say, oh, you need operation. And why should you go and do operation? It's something that can be done locally. How do you want to do a baby that is lying across? How do you want to do it? What do you want to do about it? A baby that is too big. How do you want it to come out without having issues? So the issue of cultural belief, I think, is the men that really have to come in. Because even when the woman wants to go, either even sometimes the mother or the mother-in-law, it could be either way. You want to do this, what
we did in those days. No. After all, we raised our children in those ways, and they are alive.
They are alive, but did they remember their mates that died during
pregnancy? Yes, yeah.
And that's where education, continuous education, both in the churches, has to continue. The men has to be prepared. They should be the leading point to ensure that their wives attend antenatal, their wife deliver in an hospital. And if there is any doubt or they should seek medical opinion from their obstetrician or from their midwife, not depending on what we have experienced.
In the past.
What worked yesterday may not work today. What worked for A may not work for B.
Yeah, and maybe in the days of ignorance, God
overlooked. But even then, so many of women died.
Yes.
Early childbirth, they will just say the woman died at birth. They will not say it's one witch, it's one mother-in-law, it's one is the other wife of the man. So it's not that even then there are so many people that died, but they ascribe it to witches, wizards, and
all that.
Wicked people.
Okay, just before we go, I want to ask, this is another area, because I'm picking up areas, on this maternal mortality, and it's the issue of fibroid. I don't have the number of women that have died per se from fibroid. Probably it could be.
When it comes to maternal mortality, the fibroid is separate. Yes, I think we have discussed fibroid one time.
Yeah,
or maybe we can take it. But let me just pick fibroid in pregnancy.
Okay.
A lot of women that get pregnant has fibroids. And most of them will deliver normally. But the one that we are worried about, that, especially when they deliver maternal, people that have big fibroids and they are pregnant. Some fibroid can lead to obstructed labor. If that fibroid is located down below where the baby, and that is why they must seek medical help, because from the clinical examination and the scan, they will have picked it, madam, because of this location of this your fibroid, you cannot go deliver. My other person has fibroid and she delivered by herself, but the location of your own fibroid will not, maybe it may have obstructed labor. Other according, because another thing is that when the woman has fibroid, even if the person has to deliver in hospital, because a uterus with fibroids, even after delivery, the contraction is not adequate. They are prone to deliver to bleeding.
Okay.
I'm not discussing, but I'm talking of
I understand.
fibroid in pregnancy.
Yes,
so anybody that has fibroid, they said I had fibroid when I got married. They said I cannot get pregnant. Now I got pregnant. No doctor will tell you because you have fibroid you cannot get pregnant. They not cancel her because of the location of your fibroid. No, if that's how they say I have fibroid and yet I got pregnant. Therefore I will deliver myself. Two things are critical to that. One, the location of the fibroid, and even sometimes when they deliver by themselves, the fibroid will not allow if it's so much, may not allow the uterus to contract. But if it's in an hospital, that woman delivers, instead of bleeding to death, instead of bleeding excessively that can lead to maternal mortality, adequate steps will have been taken. Like oxytocin will have been given, augmentin, the woman is augmentin will have been given, misoprostol will be administered early in anticipation that, look, this woman is at a higher risk of bleeding from a fibroid uterus.
Okay. I like the fact that you've put that, because fibroid during pregnancy, because those are the issues.
It's also a risk factor for
everybody. Yes. It's different for everybody.
If it's small fibroid, which is common in a lot of women, they will deliver, say nobody will even know.
No, that anything.
People will deliver 4 children with small fibroid. They will go on with their life. Nobody will know.
Okay. Just before because I'm going now, I want to ask this question because I know there's somebody that is watching that needs this answer. Can you drink anything to flush out fibroid? I know what I'm asking this because I know there's somebody watching and I want the person to hear this.
It's not true. They've come with, I don't want to mention, the name of the one, they will tell me come from this country, from this country. None of them has worked. None. They should not I don't know where to. And do you know the funniest thing? These drugs are so expensive. No medication. They say I have fibroid when I drank that thing and I got pregnant. And with no doctor, I just burned the fibroid. The fibroid that can come out like that is if it's fibroid polyps, which normally can, and that means it has overstayed, it has caused problem. The person refuse, and it can cut. But fibroid inside the womb, it's not possible. And I delivered the fibroid with the baby. It's not true. A fibroid that can come out through the cervix, that occasionally can cut on its own, will not even allow the pregnancy to stay, even if you get pregnant.
Okay. So
that thing is not, I drink this and I burn the fibroid.
It's not true.
It's not true.
Thank you very much. I think on that note,
I burn fibroid and I burn the baby.
I think on that note, I can end discussion because I really want to clear that because I've asked everybody that I know as a consultant and this is not possible. And today I'm asking you on the program because I know you are a professional and now you're saying it's not possible and it's not true.
There are so many
things that people do but they're not true. So
they say they are not true and they post them on net. I read it on net. Some we will call it testimonies. Why we have bastardized that word.
Yeah. Anyway, thank you very much, sir, for coming on the program because you have cleared almost everything I want us to talk about. I've really learned so much on this maternal mortality. I think we've dealt with it, and I don't think there's any woman that's listening to us or even reading and researching on this that needs to just die like that as a result of complication from childbirth. The summary of everything is that always see a professional.
Yes.
Always take your
make sure antenatal and deliver under skilled bed attendant.
Extremely important. If there's anything we're going to take away today on this program, that is what we will take away on the program. Please go for your antenatal. Very important. From when you get pregnant, start your antenatal. and make sure that you're being attended to by a skilled medical person or birth attendant or medical person during delivery. Thank you very much, sir, for your time. I'm still pulling you back again to talk more.
Anytime, it's a pleasure.
We have not finished this discussion.
It's part of our social corporate responsibility.
Thank you for taking it serious.
Thank you.
And thanks to you, viewers, for listening and staying with us. And I believe you have learned so much today. No woman needs to die. Just do the right thing. Antenatal, very important. And then make sure you're being attended to by a skilled professional. God bless you. I am Angela Nwenze, and my guest has been Dr. Nathaniel Adewole. He's a consultant obstetrician and gynecologist at the University of Abuja Teaching Hospital. I'll see you next time. Goodbye. God bless you.